Rach, how are you today?
Hey, Grace, I'm doing well. Just, a little tired.
Yeah, understood. I heard that you recently found out someone in your family has diabetes.
Yeah, actually, my grandfather was just recently diagnosed. He actually has lost some toes as a result of diabetes.
Do you understand that though? Like, do you know
Not
what diabetes
really.
is?
Not really. I wish I knew more.
Okay, well, diabetes is actually a disease that changes the way your body uses glucose. Do you know
Oh.
what glucose is?
I've heard of it,
Yeah.
but
So
I just kind of associate it with sugar.
well, that's good because
Okay.
glucose is actually the sugar that your body uses to give you energy to just
Oh,
function and help you run throughout the day.
interesting.
Yeah, so it's really hard when somebody has diabetes because your body can't use that glucose to give you that energy. So
Oh,
what
wow.
happens is your pancreas makes insulin, and the insulin helps the glucose get to all your cells,
Wow.
and that's what will give you energy. But when you have diabetes type 2, the insulin still makes glucose, but it can't get it to all the cells.
Okay.
Right. And so when that happens, you just aren't able to have all the energy and you're more tired.
Grace, how would I know I'm diabetic?
Right. So there's actually lots of signs and symptoms to help you figure out if you might possibly be diabetic.
Oh.
Those can include things like increased thirst, blurred vision. Some people experience weight loss that's unexplained. You might be really tired since you're not getting the energy from the glucose. It involves like helping your body heal, and that might not do so well. You might not be able to heal fast from injuries and other things like that. Might be numb. There's many signs and symptoms, but those are a few really telling.
So, who is more prone or susceptible to diabetes?
Good question. So you can get it during your childhood, but a lot of times older people, maybe 45 or up, are more likely. A really big risk factor is if you are overweight or obese. Usually people who are not physically active, you're not using that energy that the glucose is giving you. It can be in your family, so that might be a risk. People with high blood pressure, also some people with depression, and it's mainly about how your body's not using the energy, and that can be a big problem.
Okay.
Yeah.
Good to know.
Yeah.
I feel like I learned a lot.
Yes, and we're not done, actually.
So, what are some of the long-term side effects of being a diabetic?
Good question. It's a chronic disease that will affect you for probably the rest of your life, and so it is important to know what you're in for. A lot of people who have type 2 diabetes experience high blood pressure, heart disease, stroke, nerve damage like neuropathy, kidney damage, vision problems, even depression. Diabetes can really affect you, but that shouldn't stop you from doing your everyday life, because there's actually many ways that you can be helped with diabetes. You can have insulin pods that will just help with getting those glucose to your cell. And there's many treatments for it,
Okay,
so
good.
it's not something
doomed.
to be completely worried about. To help you understand, here's a visual representation of when glucose without diabetes gets absorbed into the body. So as you can see, the glucose and the insulin go in and they can go out. They're absorbed throughout the body because it's being able to be broken down and it's just flowing more easily. When somebody has diabetes though, there's resistance with the insulin and it stays in the blood and it can't really go out and be absorbed throughout the body. So it just gets like piled up and there's just an there's too much. There's too
Okay.
much, and it just doesn't get absorbed.
Okay.
Does that help?
Yeah, that helps a lot.
Good.
Actually, thank you so much.
Of course.
Yeah.
Do you feel like you've understood?
So much better.
Yeah.
Yeah.
Okay,
I
good.
really appreciate this.
Good. So it's important to look out for signs and symptoms.
Yeah.
And now you just have a better understanding and will be able to relate better to who you know with diabetes.
Yeah, totally. Thank you.
Of course. I'm glad we had this talk.
Yeah, this was great.